The veins that are going to be draining into the internal jugular vein have to deal with the thyroid gland. Middle thyroid vein will drain the outside portions of the thyroid gland, whereas superior thyroid veins will drain the top portions of the thyroid gland. Now here are the inferior thyroid veins. Here is superior thyroid vein on top, draining the top of it. And then middle thyroid vein will drain the outside portion, and sometimes you'll see it kind of found in different parts here, just in between inferior and superior at some point. The veins that are going to dump their blood into subclavian vein are the external jugular vein, which, if you recall, internal jugular vein is deep to sternocleidomastoid muscle. External jugular vein will be superficial to it. Vertebral vein will also go through the transverse foramen of the cervical vertebra, and it's the secondary route that blood of the brain can be drained. Cephalic vein also dumps its blood into subclavian vein, but we learned that last unit. We won't spend much time on it. Looking at our picture here, we see the internal jugular vein right here. So that would be deep to sternocleidomastoid. And then superficial to it, we'd have the external jugular vein. We can also see where vertebral vein is starting to drain from inside the skull here, and it's running through those transverse foramina. We also have to talk about the lymphatic ducts. And so you'll get more into lymphatics and physiology in the lecture component of this course. But for us, we need to learn about the two major ducts. The first one is the thoracic lymphatic duct. Now this is going to join left brachiocephalic vein kind of right as it's starting to transition to subclavian vein. It'll hit the back wall of it. Thoracic lymphatic duct is going to drain most of the lymph of the body. And so it will drain everything below the diaphragm, so the abdomen and both legs, the left side of the thorax or the chest region, the left side of the neck, the left side of the head, and the entire left arm. Right lymphatic duct is only going to drain the right part of the thorax, the right arm, the right side of the neck, and the right side of the head. A lot of times on the cadaver, the right lymphatic duct usually can't be seen as it gets destroyed during the embalming process. Now on our close-up here, the green is indicating are the lymphatic tissues. And so we can see thoracic lymphatic duct kind of coming right along the vertebral bodies here, and then comes into the backside of the left brachiocephalic vein. On the right side here, we have the right lymphatic duct. We also have to begin the arterial system. So the first part is the ascending aorta. And so the aorta is a very large blood vessel found in the body coming from the heart that's taking blood to different regions of the body. And so right as it comes out of the heart, it's going to be going upward, and that's called the ascending aorta. At some point, this portion that's going upwards is no longer going to be going just straight up. It's going to start curving around. When it starts curving, it's called the arch of aorta or the aortic arch. That's what we see right here. So the ascending aorta, we'll draw a little line here. So the ascending aorta is just a short piece as it's going upward. Once it hits right about where this line has been created, it starts curving around here, and that's going to be called the arch of aorta. Now we also have to do the branches off the arch. The first one's called brachiocephalic artery or brachiocephalic trunk. You'll also see it called the innominate artery. This is the very first branch off the arch. And breaking that word down, brachiocephalic, arm, head, it's going to have two branches. One will go to the arm, one will go to the head. And so the branches of brachiocephalic trunk is the right common carotid artery and the right subclavian artery. The middle branch coming off the arch of aorta is left common carotid artery. The third branch, which is the final branch off the arch of aorta, is the left subclavian artery. So the left side come directly off the arch, whereas the right common carotid artery and the right subclavian are branches of the brachiocephalic artery.